Hi, I'm Dr. Abhishek Mangeshikar, an endometriosis specialist and excision surgeon. Today we're going to talk about a very common question that I hear from many patients. How can I tell if my pelvic pain is serious? Pelvic pain is something that many people experience at some point in their lives. For some, it's mild and temporary, but for others, it can become chronic, severe, and even life-changing. How do you know when pelvic pain is something to watch and when it's something that requires medical attention? In this video, we'll discuss when pelvic pain is likely normal, when it may be a sign of an underlying condition, what red flags to watch out for, when to see a specialist, and how an endometriosis specialist approaches pelvic pain in clinical practice. If you've been wondering whether your pelvic pain could be serious, this video will help guide you toward the next steps. It's important to begin by understanding that some mild pelvic discomfort can be normal at certain times in life. For example, mild and short-lived pelvic pain can occur during ovulation, what we call Mittelschmerz pain, as part of a normal menstrual cycle, which is mild cramping that is controlled with simple painkillers. With occasional constipation or bladder fullness, if your pain is occasional, mild, and resolves on its own, it's usually not a cause for alarm. But pain that is persistent, worsening, or interfering with your quality of life is not normal and should never be ignored. Here are some clear warning signs that suggest your pelvic pain should be taken seriously. The pain is constant or worsening over time. It interferes with your daily activities such as work, exercise, or relationships. It is not relieved by over-the-counter medications. It occurs outside of your menstrual period or lasts well beyond it. It is associated with other symptoms like heavy bleeding, bloating, urinary or bowel changes. You experience pain during intercourse, during bowel movements, or with urination. The pain wakes you up at night. You have unexplained infertility along with pelvic pain. These are all red flags that indicate a need for proper evaluation. There are many possible causes of chronic or severe pelvic pain, and this is why thorough evaluation is so important. Some of the more common causes include endometriosis, which is one of the most common but also most frequently underdiagnosed causes, adenomyosis, where endometriosis tissue grows into the muscle of the uterus, pelvic inflammatory disease, ovarian cysts or other ovarian masses, uterine fibroids, interstitial cystitis or bladder pain syndrome, pelvic adhesions, often following surgery or infection, nerve entrapments, which may involve pelvic or abdominal nerves, pelvic floor muscle dysfunction, musculoskeletal conditions such as SI joint dysfunction, or even referred pain from the spine. Because pelvic pain may have many overlapping causes, it is vital to seek evaluation from someone who is experienced in mapping the full picture of pelvic pain, especially in cases of chronic pain. As an endometriosis specialist, I see many patients who have lived with undiagnosed pelvic pain for years, sometimes even decades. One of the greatest challenges is that pelvic pain is often normalized or dismissed. Too many patients have been told it's just part of being a woman. You will just need to manage it. Have a glass of wine and relax. Or worse, you just need to toughen up. I want to be very clear. Chronic pelvic pain is not normal, and it is never something that you should simply tolerate. One of the most important roles of an endometriosis specialist is to take a detailed and compassionate history, which means listening carefully to the patient's experience. Understand how pelvic pain behaves, what makes it better or worse, when it occurs in the cycle, what other systems are involved. Use advanced imaging where needed, such as an expert ultrasound or pelvic MRI. Recognize when endometriosis is likely to be a contributing cause, especially if there is pain that is cyclical but also occurs outside the period, pain with intercourse, painful bowel movements or urination, infertility, fatigue, bloating, or other systemic symptoms. Many general gynecologists may not recognize the full pattern of endometriosis-related pain, and that is why referral to a specialist is so important. A specialist can then offer targeted treatment, whether that involves excision surgery for endometriosis, addressing pelvic adhesions, referring for pelvic floor physiotherapy, coordinating care for coexisting bladder or bowel dysfunction, managing nerve-related or musculoskeletal contributors to pain. If you are experiencing any of the following, I would recommend seeing a specialist sooner rather than later. Pelvic pain that has lasted for 3 to 6 months or longer, pain that is getting worse or interfering with your daily life, pain that does not respond to medications, pain that is accompanied by heavy or irregular bleeding, pain with intercourse, urination or bowel movements, pain with infertility, a history of previous pelvic infections or surgeries. You do not need to wait until your pain becomes unbearable to seek help. The earlier it is investigated, the more likely we can offer effective solutions. Listen to your body. To anyone watching, please remember this: chronic pelvic pain is not normal. If your body is telling you something is wrong, listen to it. You deserve answers and you deserve effective care. Seeing a specialist, someone who understands both common and complex causes of pelvic pain, can make all the difference in your journey towards healing and towards a better quality of life. Thank you for watching. I hope this video has helped you understand when pelvic pain should be taken seriously and why seeing a specialist can be an important part of your care. If you've struggled with pelvic pain or if you have any questions, please feel free to share in the comments your story, which might help others. And if you found this video helpful, please like, share and subscribe for more expert content on pelvic health, endometriosis and excision surgery. Take care and I'll see you in the next video.